can artificial intelligence solve Africa's healthcare problems? The potential for AI to transform healthcare in lower income countries has been much hyped. Many point to the technology automating medical tasks, helping doctors to do more with limited resources, and accelerating advances if certain barriers are overcome. There's been some resistance to whether or not AI is a top priority in Africa's ecosystem. Here's a look at a tweet from physician and entrepreneur Dr. Ikpeme Neto. It says he quotes the fact that they're looking for innovations that are solving Africa's toughest healthcare challenges through AI. And he says, LOL, Africa's toughest health challenge needs no AI. It needs grit, sense, and political will. AI comes later. He joins us now from Dublin, Ireland. We also have Adeola Alli, who's the CEO and founder of OneHealth. Thank you both for joining us. Adeola, I'll start with you. Where would you rank the importance and impact of artificial intelligence on Africa's healthcare ecosystem?
Awesome. Thank you for having me, first of all. AI is important, but I think just alluding to Neto's point, is it important right now? Is that the core problem that we need to solve for? When we talk about AI requires data, AI requires mining, requires infrastructures that allows us to learn from patterns to make informed decisions. So if you do not have that infrastructure that allows you to actually use AI, it doesn't make any sense. So we need to build that warehouse, that data warehouse. We need to have that interoperability, the connectivity that allows us to then harness the real effectiveness of AI for us. So until we can do that, really, it's just work in progress.
All right, thank you for that. Dr. Neto, so it's your tweet that prompted this. You're saying the answer to Africa's healthcare challenges are great sense and political will. Can you explain further?
Thank you so much. Real pleasure to be here. I think it's important to look at what other countries have done with healthcare. Because if you go back, say, the last 15, 20 years, there was no artificial intelligence, yet other countries had decent health outcomes. They had decent life expectancies. So to think that, AI is needed for us to make healthcare progress, it's not really borne out by what we've seen. What we've seen, for instance, in the UK with the NHS is that, they had the political will to actually provide free healthcare for everybody. They did this, back in the, in the 40s when they didn't have that much money actually. And, they were still trying to figure out a lot of their, economic challenges in the war era. And so really, they didn't need artificial intelligence. They just needed the political will to say health is important. We're going to invest in it and we're going to invest in our people. Contrast that with Nigeria, where in 2001, all the African countries came to Abuja to sign the Abuja Declaration, where we all committed to spending 15% of our national budget every year on healthcare. Guess whether Nigeria has been able to do that or not. We haven't. We're not even spending up to 5%, let alone 15%. So those are the real questions is, will our governments actually spend on healthcare? Will they actually put the right policies in place, appoint the right people, and actually commit to investing in our people? The answer is they are not. And so artificial intelligence is not going to change that unless there's some type of new AI that I haven't come across that actually brings political will.
All right, thank you for that. Adeola, speaking of tech, you've just developed an app for your firm. Can you tell us about that, and then about whether or not where technology ranks in terms of priority for driving healthcare access across the continent?
Thank you, for sure. So we just launched our One Wellness app, and really it's a therapeutic management app that allows us to really support with three underlying principles: adherence, so adherence to the medication use, access to the medication, and accountability. So supporting them with clinical pharmacists that are able to really triage every 3 months, do the medication use review, and ensure that we are communicating with the doctors or other healthcare professionals if need be. The future for us, this particular product is really the pain and the issues that we see based on the customers that we've been serving. A lot of them from our online pharmacy just go online and buy one-off medications for hypertension, diabetes, and I don't see them anymore. And then they come back and they have their foot almost gone or really in a bad state, or tell me they've just come out from the hospital. And then when we did the deeper dive, we see that really and truly those three reasons, not having consistent access to your medication, not being able to take them properly, or even find alternatives if it's too expensive or whatnot, has really prevented them from really controlling their healthcare. So technology for us in this particular one, we would say it's more of telemedicine type, web conferencing technology, low form. It's not AI or anything. It's just basic. How do we just automate a little bit these processes by sending you reminders when to take your medication, by checking in on you every 3 months, by sending you for your files, you being able to save your files, you having an understanding of when to do your blood test, your sugar levels and all of that, just supporting you in your healthcare journey. So that is one aspect of technology. Obviously, we're going to deep dive later on the other types of technology that we use across the board.
Great stuff. You mentioned expense. Let me come back to Dr. Neto. Dr. Neto, we got another tweet from you where you talked about the feedback that you've given to healthcare providers that they're priced too expensively for the majority of people in the African market. Dr. Neto, how do you? Yeah, here it is. Other feedback I often give health tech founders is that they're priced too expensively for the majority of people in the African market. If you want broad adoption, you have to reduce your prices. But Dr. Neto, it's hard, like in Nigeria, for example, to do business here. How do you, straddle that line between trying to stay profitable and then not, also trying to be able to be affordable enough for your customers?
Yes, great question. And it's difficult. It's very difficult, no doubt about it. But the reality is that, the incomes in Africa and particularly Nigeria, are pretty low. Figures came out recently that, 63% of Nigerians are living in multidimensional poverty. I was reviewing recently the Lagos State Household Survey from 2020 that showed that, less than 50% of people make more than 50,000 naira a month. Only 1% of people own an air conditioner. So the figures show that Nigerians do not have a lot of cash. That's the bottom line. And so if you want to provide a service for them, you really have to consider how you price it in a way that they can afford it. Now, there are different models around how you do that, but it's really important that you don't price the majority of the market out. When you look at an affordable pricing model, what you then focus on is trying to gain volume. So can you provide a service that is affordable, but then you're able to make, profit on serving a lot of people? And if you look at the most successful businesses in Nigeria, that's actually what, they do. So in the Dangotes of this world, people that sell, food stuff, people can afford it, but they actually sell to lots and lots of people. So I think healthcare needs to come at it from that angle, is how can we aggregate, the demand so that we can serve lots and lots of people and keep our prices low. So things like health insurance are really important, places where people can go and get aggregated so that they can get better purchasing power to meet the businesses and help them be more profitable. That's what I think.
All right. Thank you, Dr. Neto. Adeola, let me get your response on that. You are one of the players in the sector. How are you dealing with pricing, appropriate pricing?
Well, I echo Dr. Neto, but at the end of the day, we have to think about the forces of supply and demand, right? And that's what will always win. When it comes to healthcare, unfortunately, healthcare, especially until it becomes an emergency of some sort, it's not prioritized by individuals. So even when you say demand and supply, you expect that, okay, you should care for your hypertension or whatever, but people don't if it's not going to be like, I'm about to die tomorrow. So this is where education reinforcement is very, very important. And like I said, finding ways to incentivize people to really take charge of their healthcare. And this is what we're doing, right? We are building a kind of a system that allows you to remind you. We're trying to give them reward points, discounts on their medication, actually. So now it's more of like habitual formation, by incentivizing you taking your medication, you checking all of that, and then maybe your drugs will be cheaper. So these are the kind of ways in which we can modify lifestyle. And just like Neto said, really just amassing a lot of the demand, trying to aggregate that demand will really help to drive down the cost for you to have just bargaining powers really with the suppliers of the medications, for example. So yeah, it's very important for it to be affordable. If not, nobody's going to buy healthcare.
Well said. Well said. Unfortunately, we've run out of time. I really wanted to get into B2B and B2C with the both of you, but maybe we'll have you back. I think we need to have you guys back and maybe start a healthcare tech roundtable. Okay, my producers are telling me we're going to squeeze some more time. So very quickly, just a minute. Let me quickly start with you. Dr. Neto, you've advised healthcare businesses to do B2B, business to business. Why is that? Very quickly, if you can, Dr. Neto.
Yeah, so I think partnership is a great way to actually aggregate, demand. So if you look, we have a number of big businesses, MTN, Airtel, the banks that actually have millions of customers. Can healthcare entrepreneurs actually work with those businesses to serve customers? I think that's a really, really great opportunity for businesses to be able to do that. So for instance, I run a small micro health insurance company that actually works with banks. We've worked with a couple of banks to actually give their customers access to healthcare plans. And so that's one way we're doing it. And I think that's a real route for us to aggregate demand and really provide affordable healthcare.
Thanks, Dr. Adeola. You get the last word on B2B. That's business to business versus business to consumers.
Yeah, so I think that question is a business question, because when I sat back and looked at it, like, is it a business question or the passion or what the problem I'm trying to solve? So I asked you a question. First of all, what are we planning to solve? Who are my stakeholders as a business owner? Like, what are my capacity and capabilities? For business to business, it's a lot better to aggregate when you work in partnerships. So when you work with at the top of the value chain, let's put it that way, it's a lot easier. However, we're realizing that continuity and gap trickles, like it doesn't trickle down to the end user. So really, we still need to pay some attention to B2C, knowing fully well that it might not be now just because of the economics. But B2B, B2B2C for me, I think is the way in which you can tackle it end to end.
Great stuff. Thank you both for your expertise. It's a fascinating segment. That's the healthcare. So much to get into. Our thanks to Adeola, Alli, who of course founder CEO of OneHealth, and Dr. Ikpeme Neto, a physician and entrepreneur. Thank you so much for joining us to talk about healthcare and technology and how they intertwine.